So one of the things I get questions a lot about is the vagina, the menopausal vagina. It turns out that in menopause, estrogen levels systemically in a woman's body drops. That also means that the level of estrogen experienced by the vagina also drops. And when that happens, some pretty major physiological and structural things happen. The vaginal lining thins out, the vaginal lubrication decreases, the level of lactobacilli or acid-producing vagina in the vagina drops. And when that happens, it makes the vagina thinned out, structurally weak, scrappy, and it makes the bladder irritable, and the protection that the vagina used to provide against bacteria decreases as well. So that vagina will thin out and be scrapey and make it painful during intercourse. The levels of normal, good lactobacilli, good bacteria in the vagina will drop, and the protection against UTIs will decrease because the acidity of the vagina decreases as well. The lining of the vagina, by thinning out, also causes irritation of the bladder, and the bladder becomes more irritable, so women tend to have more symptoms of urinary frequency and urgency in this time of menopause as well. And because the vagina is really scrapey and thinned out, trying to access the pelvic floor through the vagina as a physical therapist would make it really difficult due to the scrapiness and thinning out of the vaginal walls. So it turns out that even trying to offer a woman physical therapy in a menopausal state with a poorly estrogenized vagina is going to be a problem because it's going to hurt. So taking care of the first order of business with the menopausal vagina is getting estrogen on board. And by getting estrogen on board, it re-thickens the vaginal lining, increases lubrication, protects against UTIs, softens the bladder lining and makes the bladder less irritable. Women will notice a decrease in urinary frequency urgency. Many women will report a decrease in the amount of times they have to get up at night to urinate once they start the vaginal estrogen. And sometimes urge incontinence can be made better with the right kind of vaginal estrogen therapeutic regimen. Sometimes, because the estrogen also plumps up the urethra itself, it can have some small effect on stress incontinence in women by thickening up the vaginal lining, and we've seen that many times in our post-operative menopausal women who've had prolapse surgery. Sometimes they have a little leakage right after surgery. Even though they tested negative for leakage preoperatively, vaginal estrogen will help resolve that problem as well. So estrogen for the vagina is more than just a lubricant. It's physiologic, biochemical, and it has some structural propensities to it that allow the vagina to heal and behave more like it was when you were much younger. So getting vaginal estrogen back can actually make the vagina be younger. And I say to our patients quite seriously is that if you really want a girlish vagina, time to start the vaginal estrogen. And I do get questions as to how long do I keep the estrogen going in the vagina? And my answer to that tends to be, as long as you want a girlish vagina, keep the estrogen going. I do get also some questions about how do we start it up. We call it the ramp up protocol, where we ramp up the vaginal estrogen. So we say, we prefer the creams to the other preparations because it delivers a consistent amount of estrogen into the vagina. I usually go with 1 gram inside the vagina every night for 2 weeks, and then 3 times a week thereafter. That helps to rapidly build up the vaginal lining and restore the vaginal biochemistry fast enough so that women can start noticing relief. Most women will notice relief within 4 to 6 weeks of starting that. Other methods for estrogen in the vagina involve something called an estrogen ring or an S-string. It's a brand name device that it's like a little ring. It's like a diaphragm, for those of you that remember the diaphragm. It's clear colored, it's coated, or it's infused with estrogen in it, and it delivers a set amount of estrogen into the vagina. Systemic absorption, it doesn't get into the bloodstream very much. Systemic absorption is really low, and it lasts for about 3 months at a time. They tend to be a lot more expensive than vaginal estrogen, depending on what your insurance is or what your copays are and so forth. It could be anywhere from $500 to $700 for a 3-month vaginal ring, so they don't come cheap. But they have the advantage of going in, it's a fire and a forget situation. You put it in and you can forget about it. Most women are able to have intercourse because the location of the ring is high enough that it doesn't get in the way of intercourse, and most partners don't feel it, we're told. And so that's another alternative as well. I personally prefer the vaginal estrogen. The price is right. It tends to be probably half as much in terms of expenses, and if you get it compounded, sometimes the cost can be much lower, probably on the order of $30 a month versus $200 with the vaginal estrogen ring. So it's pretty effective.